हॅलो हाय नमस्कार, मी आहे काजल आणि माझ्या यूट्यूब चॅनलवर तुमच्या सर्वांचं स्वागत आहे. तर आजच्या व्हिडिओमध्ये आपण बघणार आहोत की साय टीबी स्किन टेस्ट ही कशा प्रकारे करायची आहे याबद्दलची पूर्ण माहिती ह्या व्हिडिओमध्ये दिलेली आहे. तर नक्कीच बघा हा व्हिडिओ कसा असणार आहे.
Demonstrating administration and measurement of SciTB skin test. Explain the procedure. Material needed for the procedure are a 10-dose vial of SciTB, sterile gloves, alcohol pads or spirit, 1 ml graduated disposable syringe, 26 gauge needle or suitable needle for intradermal injection, sterile gauge, ballpoint pen and a scale for measurement. Check the vial visually. Vial should be free from particles or aggregates. Mix by inverting 2 to 3 times. Mixing should be performed gently. The test may only be administered if the solution appears as clear and colorless to pale yellow. The skin test for TB is to be given on the volar surface of the forearm. Cleanse the area with alcohol swab and allow the area to dry. SciTB is administered by injecting 0.1 ml of SciTB solution intradermally. The solution should be injected using a 26 gauge needle with a 1 ml syringe with the needle's bevel facing upwards. Hold syringe flange parallel to the forearm. Angle of needle to the skin surface should be between 5 to 15 degree during injection. Avoid areas of skin with veins, rashes or excess hair. Inject the test solution into the superficial layers of the skin on the volar surface of forearm. A 6 to 10 millimeter wheal or papule is formed. It is a pale, raised area with distinct edges, having orange peel appearance that does not disappear immediately. Return the vial to the refrigerator after administering the solution. If the papule is not formed, repeat the injection at least 2 inches away from the first site on the same arm or on the other forearm. If minor bleeding occurs, dab the injection site with a cotton swab or sterile gauze without applying pressure on injection site. Avoid covering the area with a bandage. Discard the syringe and needle. Record the date, time and site of administration. The patient should be advised not to scratch the site and to wait for 10 to 20 minutes after injection. The patient should be asked to return for a reading of the skin test between 48 to 72 hours after the administration. Induration can be measured by palpatory method. Here, we gently stroke the area around the injection site to identify any raised margins. The identified raised margins are then marked with a pen. The diameter of the indurated area should be measured across the forearm, that is, perpendicular to the long axis with a millimetric ruler. Sometimes, redness or erythema is observed. We should measure only induration and not erythema. Induration is hard, dense and raised formation. Induration can also be measured by a ballpoint method. Record results in mm of induration with size greater than or equal to 5 mm considered as positive for TB infection. 5 mm cutoff is universal for SciTB skin test irrespective of age, BCG vaccination and HIV status.